This is the fourth time when medical supplies in materializing the vision of building a China-Africa community of a shared future and common health, and are also an expression of amity between both sides. Today's batch of supplies include 36 thermometer scans, 9,500 medical gloves, 3,800 protective face shields, 3,790 protective clothing, and 18,900 nucleic acid test kits. In addition, there are 2 ventilator machines in this package, which are vital for caring patients. I believe these medical gears will be a much help for prevention, testing, and the curing efforts taken by the Gambia government and the people. Ladies and gentlemen, since the first local COVID-19 cases reported in March 17th, the Gambia government, with strong resolve, took a series of containment measures, including border control, assembly restriction, and rapid hand-washing facility setting. Such intervention effectively mitigated the outbreak from spreading and prevented the frightening scenario where jumped from occurring. We believe that with the cooperation and joint efforts from people of all countries, our humankind will gain the final victory. Ladies and gentlemen, the right of life and the right of health are universally acknowledged as basic human rights, just as pointed out by UN Human Rights Commission, by IOM and WHO. Only when inclusive approaches are taken to protect every individual's right to life and health could the COVID-19 pandemic be eventually controlled. China always put people's life, security, and health first. This is also the guiding notion set for us to conduct our work of pandemic containment. From citywide lockdown to travel restriction, all such temporary policies are intended in all such temporary policies in China are intended for one purpose: protecting people's lives, security, and health. Meanwhile, Chinese government attaches great importance to the protection of life and health of foreigners in China, treats them all equally, and opposes any discrimination actions for any specific group of people. China has always been a good friend, partner, and brother for Africa. Just as we received the solidarity and support from Africa at the key moment of our battle against the pandemic, now, when Africa is facing increasing pressure from COVID-19, Chinese government and people have been taking quick actions to support African countries. Prior to today's handover, another batch of medical supplies from Chinese government was handed over yesterday at Banjul International Airport. And the Chinese government is organizing a new batch of donated supplies for next phase. to assist African countries, including the Gambia. We will soon to have another handover ceremony for the new consignment of the medical supply in the coming future. I believe all of these supplies are to be helpful for the Gambia amid this trying time for tackling COVID-19. Ladies and gentlemen, friendship between China and Africa is rooted in our long shared history. No matter how many times challenges strikes, our friendship will continue to endure and grow. China is ready to join hands with the international community, provide help within our abilities, and assist the Gambia to win the final victory in this war against COVID-19. Thank you very much.
Thank you very much, His Excellency Ma Jianchun, the Ambassador of the People's Republic of China to the Gambia. I know he's been very supportive to the health sector because of the confidence.
Thank you so much for this opportunity. Minister of Health, Honorable Dr. Amadou Samate, Your Excellency Ma Jianchun, Ambassador of the People's Republic of China, Dr. Desta Tirune, WHO representative in the Gambia, my colleague and compatriot, Director, Mr. Sabali, respected colleagues, members of the press, ladies and gentlemen, all other protocols observed. I'm very pleased to join you here again today in the handing over of the another consignment of the COVID-19 medical equipment from Jack Ma Foundation. And this time we also have a solidarity pack that has been included in the package from WHO. And it is only just the other day that we were together receiving another consignment from Jack Ma as well. And just yesterday we were receiving another consignment donated from the People's Republic of China. These supplies have reinforced the capacity of the Gambia's health system to contain the COVID-19 outbreak. We are indeed grateful to you, Your Excellency, the Ambassador, and remain indebted to your government of China, Jack Ma Foundation, and of course the WHO for this much needed assistance. It is a moment like this that we know who a true partner is, a friend and an ally. Honorable Minister, in addition to your tireless work and being yourself at the forefront of this fight, I would like to appreciate the measures taken by the government of the Gambia in collaboration with those of WHO as duty bearers to contain the COVID-19 in the country and protect Gambians against the spread of the coronavirus. These and other measures put in place to contain the spread of the virus signify government's commitment to the well-being of its citizens and are attributable to the slow spread of the disease in the country, as we only so far have 10 positive cases who are being monitored vigilantly. The United Nations will continue to support these measures, including interventions for mitigating the socioeconomic impacts of the pandemic. The role of philanthropy, such as this and others that we have seen in responding to the pandemic, is therefore critical and should be encouraged and recognized. Local actors, including private sector and others in the Gambia, are already embracing this challenge and have been contributing in meaningful ways to fill the various gaps, and we appreciate your support. Let us concert all the efforts around the government and in addition call upon all Gambians, including the youth, to continue whatever they are doing. We see them doing a lot of videos, music, etc., volunteering their time, their talent, and the energies to contain the spread in their own communities. Honorable Minister, Your Excellency, the Ambassador, ladies and gentlemen, this second wave from the Jack Ma Foundation includes much needed, I won't go into the numbers because they've already been mentioned by His Excellency, but includes much needed ventilators, 10 of them. And so we know that this consignment also couples up with that from WHO, and we thank you both. Thank you very much. I heard the Honorable Minister saying yesterday, when we were receiving the consignment from the government of China, that, oh, I have been waiting for the disposable shoes. So you can see these consignments are much needed, very necessary, particularly to protect our frontline staff and medical teams. Already, WHO, WFP, and other UN agencies have repositioned themselves for business continuity, as you can see, so that we ensure social distancing, but so that we also maintain life-saving programs in strategic areas. For example, despite schools being closed now, under the leadership and collaboration with the Ministry of Primary and Secondary Education, support to school feeding programs will continue, where we just need to provide a much needed take-home ration, probably to the young children, to take home with them, while also we ensure that we follow the guidance of social distancing and hygiene. This is something that is being worked up currently. World Food Program, in collaboration with WHO, will soon be establishing a long-haul regular cargo and passenger air transport service in partnership with African member states, in partnership with other member states. This will be part of a global initiative to support global efforts to move cargo and humanitarian support swiftly and efficiently in the region and globally. With several borders closed and flights cancelled, ensuring countries receive deliveries such as this one that we've been facilitating with the People's Republic of China is delivering much needed medical equipment that is increasingly difficult to move within the continent. To support global efforts and to move cargo and humanitarian support swiftly, the World Food Program will be working very closely with also every other member state. In closing, I would like to reiterate my appreciation to all health workers, security personnel, drivers, all those who are involved in the essential services. We have not forgotten you, but we also appreciate your service. I want to appreciate particularly the collaborators who have been working with in the Ministry of Health. They've been working tirelessly. I was just mentioning that I was so impressed by the passionate commitment of the government. We've been working late hours into the night, and they're there with us. We are there supporting them late into the night, working over weekends. I have been very impressed. So we continue to urge Ugambians, as the government is working with the other partners to comply. We also, with the measures, we also call upon you to comply also with the measures and regulations of social distancing, wearing masks where possible, washing hands all the time, and staying at home to the extent possible. Every single one of us has a role to play. By keeping your distance, we can slow down the spread of the virus. United Nations in the Gambia, under the leadership of the resident coordinator, will continue to support the government and all Gambians and Gambian residents to emerge stronger from this crisis. More than ever before, we need solidarity, hope, and love to see this crisis through together. I thank you for your attention.
Thank you, Madam Wanja, for that excellent statement. And also thank you for thanking the staff for working extra hours. But I think we are emulating our leader. The Honorable Minister, as you know, does not have any weekend and does not have any closing time. So we are also following his footsteps. So he cannot be in the forefront and we are behind. So we are together in this. So we thank you for that. You're also another friend to the Minister of Health. And then thank you for all the support that has been rendered. So I now invite Dr. Desta Tiruni to come and give a statement. Doctor.
Honorable Minister of Health, Dr. Samate, Your Excellency, the Ambassador of the People's Republic of China, my colleague Wanja, the UNFPA representative and the director of the ceremony, Dr. Mr. Mojunjai, and people from the media, ladies and gentlemen. This is another occasion again to be happy with in the middle of crisis. We are in crisis, but we are also very hopeful. But by doing something to strengthen the response mechanisms, we'll be able to deal with it better. So it's very much welcome development. Just globally, as you can see, the COVID-19 outbreak, the pandemic is going on, and many countries have been affected. There are very few countries that are spared from this. Almost all countries are now dealing with it at different levels, some more, some less. When we come to the African continent, Africa is believed to be at the beginning of the pandemic, the outbreak in the African region, because the cases that we are seeing are not even equal to the number of some of the countries that they see in a few days. So we are just at the beginning. So all these supplies that are arriving will be coming at the right time to prepare us better for the future that may be much different from what we see currently. The number of cases in the Gambia have been few, but we still have to review also how we are doing our business in terms of testing. What we see is that the number of people that we are testing may not be to the number that we require to test. This is something that we are reviewing together with the other partners. The Ministry of Health is reviewing this, and very soon we may be making some adjustment also to make sure that we are really safe enough to move forward with the situation. But from the forecasts what we have some projections that show that in a few months' time we might be having quite a number of cases. So for that we have to prepare, and these are the most important things to do. So globally, the WHO and the partners like the People's Republic of China and other UN agencies are putting their efforts together. And I'm not sure which supplies are which, but I know that the government of China has put a lot of supplies in this package. And also with the JACMA Foundation, also the UN has also put what we call a solidarity response, some basic and necessary equipment and supplies that are needed for the response. So this is a demonstration of everybody working together. It's a solidarity that we need globally. At local level also we need the same solidarity to work together to defeat this common enemy. It doesn't know any borders, it doesn't know any race, it doesn't know anything. There is no distinction for the virus. We are all the same as human beings. This is against humanity. The disease against humanity. So we really appreciate this collaboration between JACMA and the different governments and the UN entities and the government of China to work together towards the same objectives. It's very, very much appreciated. So I would like to express my thanks to the government of the People's Republic of China and the World Program, which is also our agency with expertise in the logistics, which is facilitating the transition, the transportation of all these supplies, and also the UN agencies and the WHO, who are also supporting in different ways to make sure that what is required by the countries, particularly in Africa, is available at the right time. So I would like to express my sincere appreciation to all of you, but the fight is still starting. That's what I want to pass to all of you. The fight is still starting in Africa. Let's prepare ourselves. And one of the most effective strategies is to keep distance between each other. But I can see that it's very difficult also to do, because people, we are used to keeping closer to each other for a long time, since childhood. So it's a very difficult behavior to change. But I advise you to really keep distance as much as possible between each other, because this is the most effective. The moment you keep your distance, you are actually avoiding the virus or keeping the virus away from others, either of the two, which both of ways will actually help us to curb the epidemic in our context. The other thing is hand washing, very important. We touch many things. Since I came, here, I have touched many things, so I have to clean my hands. If not, sometime during the day, I will touch my eyes, my mouth and nose. If the virus happens to be in my hand, I am already infected. So this is what happens. So I want you to really focus on these strategies that are very effective and working in different areas. That's why governments go for a lockdown, because people are not sticking to distancing. It's not because they want to lock down, it's because people are not sticking to that. So with the current situation in the Gambia, the only hope we have is ourselves to discipline ourselves. By disciplining ourselves, we are protecting others and our loved ones around us. So I appeal to all of you to pay attention to the necessary basic prevention advices that are coming from the Ministry of Health through different media. Please address these issues in your also different local media that you are engaged in, and pass it to the society at large. And when you pass the message also to the society, people will also see what you do more than what you tell them. I like a saying which says that I cannot hear what you are saying because your actions are very loud, which means that people will listen to what you do but not what you are saying. Because if you don't do it, people will not observe what you are doing. So thank you very much, everybody, for those who are also organizing all this event. There is a lot of process for this. Thank you so much for the media for coming and also capturing this event. Thank you so much.
Thank you, WR. That was an excellent one, and the messages he has really sent out. We hope everybody will adhere to the messages of social distancing and for us to practice it. And Minister have also been emphasizing to our colleagues that we should also start practicing social distancing. Let's also practice what we preach to people. So it's also a very good message. Before we go into the minister's statement, we will now witness the official handing over from His Excellency the Ambassador. Will be given will give the donation to WFP. WFP will hand over to WHO. WHO will give it to Honorable Minister, and then we can have it there. Yes, in front. Yeah. Yes, and that will be the last, and then that will be hand over to Mr. Sabali. Exactly. Yeah. Thank you. Okay.
Just a few more moments, please. Everybody good? Cameras? Cameras, please. Everybody okay? Okay, thank you.
Now WFP will give to WR. Now you can come forward a bit. WR, you can come this side. Yes, exactly. Thank you, Madam Wanja.
Okay, our cameras.
So, two. Now WR will give to Honorable Minister. This one I should not miss this one.
Gentlemen, everybody good? Thank you.
And now Honorable Minister will now give it to our able logistic manager, Mr. Bawandin Sabale, who is the Director of National Pharmaceutical Services. So everything stays here and is the one managing it to ensure that everything is distributed accordingly. Thank you.
Thank you.
All this is possible because we have someone who has the foresight, who is committed to the work, who is leading us to the right path. And that is why we are having support donation from all over the world. Because the people who are donating really have trust in our system, And the people donating also have the confidence in our system. That is why they are donating. And we hope that this will continue. Your Excellency, the Ambassador, this friendship should also continue. WFP, we know, we are there for the Minister of Health at all times. Likewise, WHO. Now it's a family, so even after COVID, we'll still continue. During COVID, we'll continue and we'll still move on. Even after COVID, we'll still continue as we are. So thank you all for all the support and the support given to the Honorable Minister and the team. Honorable Minister, I now invite you to give your statement.
Thank you. Thank you very much, Mr. Njai, Chairman of the occasion. Your Excellency, Ambassador Ma Jianchun of the People's Republic of China, our own sister, the World Food Programme representative, Madam Wanja, and our own brother, the WHO representative, Dr. Tiruni. My brothers and sisters from the media who are ever present, disseminating the information, keeping people informed, my colleagues from the Ministry of Health, the various directors here, Director Njai, Sabali, and Mr. Sonko, and the entire team. We are very happy to be here this afternoon to witness yet another very kind gesture from Jack Ma and the Alibaba Foundation. As mentioned by the WR, this is a happy moment in the midst of crisis, in the midst of an international challenge. But if you have crisis, if you have problems, if you have very big issues to deal with, the tools to deal with those issues, when you get them, you certainly feel happy. And that's what is happening today. Your Excellency, Ambassador Ma, we wish to express sincere gratitude to you, your personal commitment since you came on posting to the Gambia. We have seen your engagement with the Ministry of Health and the People's Government of the Gambia, the Government of the Gambia and the people of the Gambia. We've seen through your actions the social upliftment activities that you've engaged in, the collaborative efforts that you've engaged in, the support when it comes to infrastructural development, but of course with support when it comes to human capital development of this country. And certainly with support when it comes to health system strengthening of this country. We've also seen all the materials that have been donated over the period, over the months, to strengthen the gynecology program at the Edward Francis Small Teaching Hospital, building the capacity of the doctors and the nurses. Then we didn't know there was going to be something called coronavirus pandemic, or there was going to be anything called COVID-19. None of us knew. And you had been there with your government, standing by the Gambia and the people of this country, providing equipment, materials, support. The donations of the vehicles, I must tell you, have gone a long way in dealing with our situation now. Those are the vehicles that ferry the people who are on duty 24 hours in this center here. So it goes a long way. The donations of the other medical items, the initial donation from the Jack Ma Foundation, and the donations we received yesterday from the government of the People's Republic of China, all go a very long way. Yesterday we received a big number of different personal protective equipment. When there is a pandemic of an infectious disease, people are worried because it is infectious. It goes from one person to the other. So we are all worried, especially for the frontliners, because the other people can stay away from contamination. But the frontliners have to be there to care for those people. They have to be there to identify those people. They have to be there to provide services for those people and to contain the disease. So they cannot hide away from the infected people. So they are always there, come rain, come shine. Now, when they are there, they deserve to be adequately protected. And that is our responsibility to make sure that they are adequately protected. And we will endeavor to give them all what they need to stay safe. But of course, we have also known that getting these items has become a worldwide challenge. They are scarce worldwide. People are struggling. They have the funds. Sometimes they cannot even find a place to buy these items. So if we get these as donations from the government of the People's Republic of China, we are very, very grateful. These go to strengthen our resolve, to strengthen our commitment, to strengthen our collective strategies to respond to the COVID-19 pandemic and also to contain the disease in this country. Now, the current presentation today, we have seen a long list of very important items, but of course, the name ventilator has become a household name across the length and breadth of the country. Everybody's heard of what a ventilator is now, whether we know how it looks like or not, but we all know, because we know it is a very important piece of equipment in dealing with COVID-19, especially for people who are very sick. And we also know that quite a percentage of the people who get infected with coronavirus at the end of the day will need the use of ventilators, which increases their chance of survival when they go into respiratory failure. Their respiration needs to be supported. So the ventilators are very, very important, and these ventilators will be put to very good use. They are all going to be set ready just in case we need them. The thermometers are part of these donations also. Thermometers are very, very important, and yesterday as well we got a whole lot of thermometers that people have been yearning for. What that means is that all the health facilities in this country now will have these thermometers where the healthcare workers can check the temperature of individuals coming into the facilities without contact. So that is very important. That also goes to reduce the transmission of infection from one patient to the other, but also from a potentially infected person or an infected person to a healthcare worker. So we are very happy, and this will be distributed immediately to all the health facilities in this country and to various busy settings also. An example is at the ferry crossing, at the car parks. Now we are going to post people there who are going to be checking people's temperatures when they pass by. Now, response to COVID-19 and response to any major healthcare issue cannot be done by government alone. It cannot be done by a single individual. However, we have to emphasize that each individual has a role to play. If we are 100 people and each of us plays our role, which is important, at the end of the day, all the 100 people have played their roles, and then collectively we win. And that is the message we want to send to all of you. But at the policy level, at the implementation level, At the planning level, we have a very strong team. The team comprising of the Ministry of Health and the partners. These partners have been there, just like Ambassador Omar. They've been there, come rain, come shine. They are with us, supporting us behind the scenes, and when we need to come out together, we come out together. When we need to go into the communities together, we go into the communities together. They are there with us throughout, and you can see that is attested by the presence of Madam Wanja here and the WR. We all know the importance of World Food Program in the support, in the supporting framework that is put forth to government. Government is very appreciative. They've been supporting the schools, enhancing the nutrition of the students, of the pupils in various schools, but also the undernourished people, so they've been supporting the health sector a whole lot, providing essential nutrients to the mothers, the pregnant women, and the undernourished children. That goes a long way. But they've been also supporting when it comes to the logistics. So they coordinate, I'm sure you all know, coordinate these items getting here. We all know now getting things around the world has become very difficult because there are no flights flying in most places. But they endeavor, using their links, which they established long before now, to get these items into this country and coordinate it and make sure that they get into our hands and they make sure that they get into where they need to go to. Thank you very much, Madam. Of course, the WHO, it goes without saying, you know their function. They are the principal advisor of government when it comes to health issues. And government listen to them when it comes to international health issues. They give the guidance, they put forward the standards, and they give technical support as and when it is needed. And in the issue of the COVID-19 containment, even in the preparatory phase, the response phase, and of course we are containing the disease now, they've been supporting, engaging with us and partners on a daily basis, giving technical support and a whole lot of times material support, providing PPEs, which they did also, test kits and so on and so forth. So the team is a very strong team of the government, the states that are friends to the government of the Gambia, and the People's Republic of China is one very strong example of that. And the partners who are there with us throughout, we all plan these things together. In fact, a lot of times Ambassador Omar comes to me and says, Dr. Samate, Mr. Minister, where can we help you? And we sit together and decide together what we need. That is why each time we get donations, they are very, very relevant, because in the planning stage we would have been contacted and our needs would have been put forward, and that is what they bring. That is why the donations are all very relevant. We thank you very much, Ambassador. COVID-19 is a reality. Sometimes it puzzles us. How come people do not believe, some people do not believe that COVID-19 is a reality. We've been seeing it on the television. But what puzzles me more is sometimes human beings choose what to believe and choose what not to believe. If we had seen a hurricane somewhere, we would believe it. If we had seen an earthquake, we would believe it. But we see people dying in ICUs and we still say we do not believe it. It puzzles me. But I think it's probably because the Gambia has few cases compared to other countries. But the problem with that kind of concept is that it brings about complacency, and with COVID-19, that is recipe for disaster. When people think, Gambia, we are fine, we only have 10 cases for so long. This disease is not like that. We've seen what's happened elsewhere. In some countries, there would have been an initial period of detecting cases, and they get a quiet phase, a lull for some time, and then the explosion occurs. And we pray we do not get to that level in the Gambia. Nonetheless, we have to play our part. We have been advised to do social distancing. Yes, it is not easy because we are not used to it, but we can try. Let's try social distancing for the next 1 month, 2 months, and see. It will make a difference. I don't think it's so difficult when we try, and eventually we get used to it. You see, most of us have already gotten used to it in a way. By the time someone starts getting close to me, I start moving back. I leave a gap. You know, it's in my subconscious mind now. As one gets close to me, I start moving. So let's try that. It is helpful. It's a contagious disease. It's an infectious agent, and it moves from one person to the other. So if we keep a distance, the risk of being infected will be low. The use of the mask has been advocated. Masks are not also so easy to use, not comfortable at times, but it makes sense to use the mask. It makes sense to use the mask so that the respiratory droplets from whoever is affected can stay in the mask. Now, when we say that, some people will say, well, they are not affected, so it should be the people who are affected who should keep their respiratory droplets in there. But we do not know who is affected and who is not affected. So if we all do so, that means the person who is affected amongst us will be able to protect the others. But I think it's also our individual and collective responsibilities to contain the disease so that whoever amongst us is infected doesn't infect more and more people. So the hand washing is still valid, no room for complacency. Let's get together and do what can be done at the individual and at the community level to contain COVID-19 in the Gambia. Once again, we want to thank all of you here. Ambassador Omar, we want to say thank you very much. WR, Dr. Tiruni, Madam Wanja, and all of you here. And we would like to use this opportunity to thank our healthcare workers. Our healthcare workers are working tirelessly day and night to contain COVID-19. They do not sleep well. They also are human beings. They go through trauma. They get afraid sometimes. But irrespective of all that, they are always there for the patients of this country. Whether the person has COVID-19 or not, they are always there providing the services, and the work is risky. Being a healthcare worker itself by nature is risky, but it is even riskier when there is a communicable disease outbreak. And this one is a pandemic now, and we want to use the opportunity to thank them for being steadfast, to thank them for all their sacrifice. To the security forces who are also working with them all the time, we say thank you. The people of this country recognize your input, and we say thank you. And of course, to you from the media, your role is very, very important. When we talk about information dissemination for infectious diseases, because it spreads like wildfire. So when it spreads like wildfire, news also spreads like wildfire. So the news should follow the spread of the infectious disease to counteract the spread. How can we counteract it? By informing people and empowering them to be able to protect themselves, protect their communities, and of course, what's the best way to get that to the people? Through the media. But of course, by also counteracting and refuting misinformation, because misinformation is very dangerous. I think sometimes people say no information about an issue is better than getting information that is totally incorrect and false and detrimental. So we encourage people to only spread the correct news and to verify before the information dissemination. But we want to use the opportunity to tell you that we appreciate your role under the sun, running around, rushing to conferences, giving coverages and broadcasting, rushing to catch deadlines. We wish to thank you very much. Once again, I thank you all for your kind attention.
Excellent statement from the Honorable Minister, and also with clear messages for all of us, and trying to emphasize on the issue of social distancing, hand washing, and also extending thanks to all of you. So thank you all for coming. That's the end of the session. So Honorable Minister, thank you for coming and leaving your busy schedule in the office to come and attend this occasion. Excellency Ambassador Ma, WR, and also our able sister, Madam Wanja. And then, so thank you all for coming.
Thank you. We have sanitizer the more.
I go sanitizer the more.
Thank you, Director.
Yeah, thank you. Thank you.
Well done.
Thank you very much.
Excellent job.
Thank you.
Have your say.
Fellow Gambians, my government has approved a $500 million emergency fund, which the Ministries of Health and Finance will work on for disbursement and use to fight COVID-19 menace.
xaalis bi tege yomb na waaye xamul lu jafe mooy séddale bi niñ ko séddalee ak ndax danañ ko jox ñi ko yeeyoo wala duñ leen ko jox loolu moo jara laajte.
cos loo xam ne la nit yee tax ñu joxe ko te nit ñi ñoo leen fa teg te xaalis nit yi la comme xaalis population bi la wax dëgg yàlla li gënoon mooy ku nekk gis sa boppa
man su ma sañoon daal ñu séddoo ko nu mu waroo buñ si def xaaj loo ñii diw nañ ko si ku nekk loo war a am nga am ko.
askan bi seen dem ak dikk bu ñu wàññee mu jël ko def ko si loolu noonu participer ko si loolu noonu ba nga xam ne danañ mën a ànd ak moom si wàññi suñ dem ak suñ dikk.
génne leen xaalis bi nañ ko génnee ñu defar suñu réew mi defar réew nag da nga koy commencé njàng mu baax nit ñi di faju feebar di faju tan feebar di faju dafa xemul kombo loolu affaire bi du kombo rek nañ génne ci àll bi yëpp ñu defar fa hôpital li war man mi nekk kombo moo war ka nekk fototo moo war ka nekk Pokaw Njóogu moo war ko nekk feneen.
waaye nit doo ko mën a wax mu teg këram joxuloo ko dara lu mu lekk soo ñun balaa corona dañu rey xiif moo ñoo rey.
nguur bi su nekkee ne 500 millions Gambie ñaata population bi ñu ñaata lañ.
2 point or 1 point.
ok 2 point boobu noonu su nekkee dañ ko war a séddale si nit ñi ku nekk ñaata la war a am.
million su bëri soosu noonu nañ ko xaaj jox xel benn xaaf ñu téyegum ñu jël beneen xaaf bi yóbbu ko ci communauté bi ñu téyegum.
ko silang ni nga arda ko bulu courant lu sorota ani borolu sayin pentanlu panande nyante hakilo falol fanan kanne
ya foko ngata si